Hello and welcome to this week's installment of the Weekly Health Insurance News Roundup brought to you by Health Insurance Online. This week we don't really have a theme per se, we just have a bunch of rather interesting articles that have to do with the uninsured, universal health care, mandated health insurance, and so on. So to begin, the first article looks at a study by the Centers for Disease Control in which it found that the southwest portion of the United States, specifically Arizona, New Mexico, Texas, and Oklahoma, have the highest rates of uninsured residents in the nation. The study notes that nearly 30% of non-elderly adults and 18% of children are uninsured across those states, which is a huge gap between the Southwest and other regions like the North Atlantic or, the Mid-Atlantic or the Northeast. The next article comes from the Star Press, is entitled "Healthcare is Complex, the Fix Will Be Too." This article takes a look at the rising demand for healthcare services, the bifurcated system of healthcare payment in which those that don't have insurance go to the wrong place, i.e. the emergency room at the wrong time, i.e. when they're actually ill, rather than actually going to a doctor to get preventative and regular healthcare checkups. This proves quite costly for the health insurance system as a whole and the healthcare system as a whole. And the article goes into some solutions as to which either customers, hospitals, or the government choose how we receive health care, as well as making everyone purchase health insurance. There's some interesting ideas, but they are as complicated as the system they're trying to fix. A little while ago, in the next article, we looked at Massachusetts' mandated health insurance system and how well it's going. While most people see it as a boon, an article entitled "Health Insurance Mandates Unhealthy for Business" in the Boston Herald, the authors looked at how a possible new mandate from the state government could rise health insurance costs even more for state businesses who are already paying a lion's share of the health insurance costs in the state. But the article doesn't provide any solutions, so we'll just have to wait on that. The next article from the Philadelphia Inquirer looks at how New Jersey is looking to become one of the first states in the nation to provide some sort of universal health care coverage through their revised family care bill, which would not only cover the children of low income families, but also the parents as well. So that'd be a big step to providing universal health care coverage across the state. The $90 billion plan would go several phases, but proponents of the plan say it would cost taxpayers less money than they're currently paying to cover the uninsured when they get health care. The final article in the Wall Street Journal is entitled "More Americans Delay Health Care," in which the author discusses the rising number of those people who put off getting health care, surgery, etc., because of rising costs. Even those who are insured are putting off getting the health care they need because of the rising costs. The article cited one example of a gentleman who put off surgery of his arthritic hip for 2 years, even though he had health insurance, just so he can get covered under Medicare. Kind of a sad state of affairs. So those are the articles that were found most interesting for this week's Weekly Health Insurance News Wrap-Up. And to read the whole article, go to Health Insurance Online. That's www.online.health-insurance. That's online-health-insurance.com. Thank you and have a great week.